Hello, everyone, and welcome to the Kathy Barnette podcast. Thank you so much for taking some time out to listen. I'm just going to jump right in because I am so excited to have an opportunity to spend some time with Dr. Lauren Schwartz. Dr. Lauren, thank you so much for coming and spending some time with us.
Oh, I'm so thrilled to be here, and I just really appreciate you taking time out of your day to spend time talking about this with me. So honored to be here.
Yes, you don't know this, but I've become very close friends, I would like to say, with Chloe Cole. Are you familiar with Chloe?
Yes, I actually got to meet her in person recently.
She is adorable.
Very courageous young lady.
Oh, she's so courageous. Precocious is the word that comes to mind when you first meet her. She is mature beyond her years, and yet I find that precocious little kids are perhaps some of the most, or perhaps a little bit more at risk of being exploited by some of the things that we're contending with in our culture, because people tend to look at them and say, oh, they're so mature, and think they know more than what they know, but they're still kids. And so before we jump in, I just wanted to say that about Chloe, because, I'm not a doctor, as I said to you earlier. I am a mom, but I'm living and breathing and walking in the culture that we find ourselves in. And there are a number of things that bring great stress and alarm to me as a woman, as a citizen, as a mom, as a wife. There's a lot of things that bring great distress. At the top of that list is probably what I'm seeing take place among our children with this rush to transition our children. It is bringing me great distress. So I know my audience hear me talking about it a lot. I spend a lot of time with Chloe. And I think as I, have just had the opportunity to spend such a large amount of time with her in a variety of settings, I'm becoming even more determined to talk about what we're not supposed to talk about in this culture. You're just supposed to shut up, sit down, and go along with everything. And that's my premise of bringing you on. And so before we begin, if you can tell us what it is that you're a doctor, and if you can talk to us a little bit about your focus of medicine, and then we can go from there.
Absolutely. So, yep, I am board certified in psychiatry, and I am in private practice in Oklahoma. And I think part of what's unique about my approach to psychiatry is that I have always been very passionate about the psychotherapeutic side of it. That medicines can be one small tool that we have to use, but not, this one thing, one pill to fix everything, where I love the psychotherapeutic side and working through challenges that patients are having in their lives, meeting them where they are.
And do you primarily focus on children?
No, I actually, I see adolescents through adulthood. So think about, probably age 12 or 13 all the way through 130. So I'm not fellowship trained, meaning we do 4 years of medical school and then 4 years of psychiatric residency, during which we do get a tremendous amount of child development and training. And then some choose to go on and do a full fellowship in child and adolescent. And that I'm not fellowship trained. But like I said, I do have a lot of training, working with all age groups.
Help us understand the difference between a psychiatrist, a psychologist. You use the word psychotherapy. Explain those three for us.
Oh, absolutely. So they're basically just education differences. So if, for example, a psychologist will have a PhD or SID, and they do, after college, they go on to a 4-year program typically, and then they'll do an internship following that and specialize at times. They can do neuropsych. You can do neuropsych testing. They do a lot of clinical research. If you look at counseling, or if you look at licensed professional counselors, typically they will do undergraduate work, and then they'll do a master's and then an internship where they're working in a therapeutic process, and they do training in therapy only. Versus for a psychiatrist, we do a very broad base of the 4 years of medical school, which is 2 years of book work. You're sitting for your first boards, but you're studying all different kinds of health and wellness, and then pathology and human pathology, from endocrinology to cardiology to neurology to psychiatry and human behavior. We then do our rotations where, you go and rotate with an OBGYN, or in our case, in the hospital, deliver babies, work in the gyn-onc units. We do pediatric rotations, internal medicine rotations, like I said, endocrinology, I think I mentioned, neurology. You kind of get to try everything out for a few weeks, and that's when you're determining what you want to specialize in. And then by 4th year, most people know what they're going to specialize in, and then you match with a residency program. And so then you do your 4 years of specialty training. And then in specialty training, I think some people miss that psychiatrists receive a tremendous amount of psychotherapeutic training. And then, like, personally, I then sought out an additional year of psychoanalytic training through a psychoanalytic society here in Oklahoma. You don't have to do that. Some psychiatrists do psychotherapy. Others choose not to and do more medication management, but we still use it as a primary tool with every single patient.
But with the psychiatrist, you get to administer medicine. And that is one of it's out, as you explained, it seems like a lot of differences, specifically in the amount of education between a psychiatrist and a psychologist. But one of the other things that you get to do is administer medicine to your patients, right? Now, when someone says psychiatry, psychologist, usually people like myself, layman people, we go psychiatrist, psychologist, whatever. But we're generally thinking about someone who is going to sit down with someone to talk about mental health issues, or to help whatever it is that they're talking about. It is helping them to process their thoughts about themselves, about the world around them. Is that generally what you do?
Absolutely. Yes. I think, and when you look at a comprehensive psychotherapeutic approach, you look at like a psychodynamic approach where you're looking at someone's childhood history, you're looking at their family dynamics, you're looking at their interpersonal relationships with people in their lives, their family, their spouse, perhaps their children. And then you also look at intrapersonal and how their sense of self and that development of sense of self. You look at their medical history. Did the biological side of their history and their current struggles, is that influencing them? And that was, a benefit of going through medical school is, by no means am I going to go practice cardiology, but we got to do enough studies in cardiology and healthy functioning, as well as medications, where I can at least talk with and consult with someone's cardiologist or endocrinologist if there are things that are interacting, whether it's with psychiatric,
with how a person think and how a person see themselves. So you look at total body, but really with the focus on how all the systems of this individual person's body is impacting how they think about themselves, how they think about the world around them. Is that
absolutely
a layman? am I?
Yeah.
Okay, good. Because when I think about the world of transgenderism, and specifically, I just want to focus on children, right? As adults, I may not agree with your choices. But at some point, we have to allow adults to live their lives as they see fit to a greater degree than we ever would with children. And in the conversation of transgenderism, my general thought is, as an adult, if you want to do this, if you want to mutilate your body, if you want to, and I'm not paying for it as a taxpayer, then for the most part, what can we do? Right? I mean, like, there's a number of things that's a whole different conversation for me. But with children are not adults. And I believe we have to see it that way, and we have to put up guards around them to protect them, even from themselves, to protect them, even from adults. On the last presidential Republican debate stage, one of the questions was around transgenderism and should the government have a role in determining if a child should be able to seek transition or not. And it was kind of split. You had two on the stage who said the government absolutely should intervene and put up road guards so that with laws prohibiting children under a certain age to make these life-changing alterations. But then there were another two on the Republican debate stage who said parents should make that decision. And I'm thinking to myself, we don't allow parents to abuse their children, even if the parents think it's in a child's best interest. Why would we allow parents to be the sole determiner of this? But I asked you to give us an understanding of psychiatry, because one of the things I've noticed as I'm around Chloe and several others who have transitioned that she's introduced me to, they start off saying things like, when I was 11 or when I was 12, I came to the realization that I was born in a wrong body, that the body I was born in doesn't match with how I think about myself. And the solution for Chloe, for example, was within 6 months, they put her on hormone blockers. And within another 6 months or so, she was being pumped testosterone in her body. Within a couple of years, they were doing a double mastectomy. And by the grace of God, she woke up. She could have been like her friend Katie she introduced me to, who then went on to get a full hysterectomy, all within a year's time. So I wanted to understand what psychiatry is, because Chloe said one of the first steps she went through when she told her parents, and her parents took her to Kaiser in California, they sat her down, they scheduled her with a psychiatrist, who then began the Affirming Care parade, so it starts with mental. They recognize there's something mentally going on, but the solution seems to be a fast track to physical alterations. So help us understand that if we understand that psychiatry, or psychologists, whichever one a young person is sitting in front of, this is generally one of the first steps, a child who is about to go down the transition path. This is one of the first things that the primary doctor would schedule them for. But a psychiatrist who should be in the business of doing no harm, how do they jump from a mental issue with how this person sees themselves personally and how they see themselves in the world? How do we jump from what's going on in a person's mind to let me mutilate your body. Let me give you a full hysterectomy. Let me give you a double mastectomy. Help me cross that bridge of how they think that is the remedy. A physical remedy is the solution for what's going on mentally. Does that make sense, what I'm saying?
Absolutely. It makes sense what you're saying. It does not make sense to me ever. And that's why I've started talking about this, why you would ever put a child on that path, that you would ever start with the assumption that they were born in the wrong body. So starting from that assumption, affirming that assumption, telling a child, you're right, you were wrong. You were born wrong. And so we're going to do everything we can to quote unquote affirm, not affirm their childhood, not affirm their natural development, which puberty, and we can talk about that too. That's such a huge part of not just, secondary visible features, but your brain development, your cognition, your development as into a reproductive adult. There's so many things that the medical community is failing these children and families on, and they're arresting that development. And then they can't necessarily get back on track. You mentioned it's a fast track. It's a fast track and it doesn't have off ramps. And that's where I started to, my whole approach has always been, if I'm going to sit in a room with someone and discuss something, whether it's with my patients or it's with a school or if it's with, a colleague. I want to understand everything that I can. And so the more I would look into this, the more I couldn't understand what on earth was happening, because especially with children, in children, we just don't ever want to close any doors if we can help it. So you keep everything as least invasive as possible. If we can avoid medications of any kind, wonderful. If they're necessary, we're going to explore and make sure we're always explaining side effects and risks. And all of a sudden, if you, for example, discuss side effects of a puberty blocker, you're somehow transphobic. And I'm here to fight for the safety and stability and wellness of all of my patients through their entire life, not just in a moment in a room.
But help me understand, I mean, because these are not dumb people. You just walked us through the many years of training. You mentioned words. I have no idea what they entail. So you're very smart from an education perspective. So we're not dealing with, I mean, all of us are ignorant of something, right? Ignorance simply means a lack of knowledge. But to the extent that you can eradicate ignorance, it appears to me that people like yourself, psychiatrists, psychologists, you have done a great deal of work in education to understand how the body works, to understand how the mind works, to understand if someone like me understands that if my foot hurt, I wouldn't go to a cardiologist about it. All right. I would go to a podiatrist, right? If I'm having issues with my eyesight, I wouldn't go to, I don't know, a kidney specialist. I would go to someone who will focus on that particular area. And if I went to a podiatrist and he started talking about my heart, I would have a problem with that just as an individual, right? I'm not trained as a doctor, but as an intelligent and growing, learning individual, I would know something's wrong with that. So help me cross the bridge of how we have very smart people, many of whom I do not believe wake up saying, I want to do harm today. And yet, smart people who are good, quote unquote, as we would define it for most purposes, say to themselves, I'm dealing with a mental issue, a mental health condition. If someone says, I know I'm a girl, I've been living like a girl for the past 12, 15, 30 years, but now I think I'm in the wrong body, that speaks to me as a layperson that there's something mentally going on. So how do these smart, educated, well-trained individuals who are not waking up saying, I want to do harm today, bridge the gap and become comfortable with children to take something that is a mental health condition and begin to mutilate their little bodies?
Well, and I think there's so many different things that are showing up in this as I learn more about it, and the individuals that maybe began this movement. It's very different than where we are now. And I do think when you look at, like you were talking about, children that even at a very young age can be very well spoken and very convincing. You'll hear people say that they're persistent, insistent, consistent. But at age 8 or age 10 or age 12, you can say, well, they've been persistent their whole life, but that's not a very long life. And you think about a child being very convincing. And here's the thing, the distress that they feel is absolutely real. By no means do you want to invalidate that they're not feeling something that intense. They are, but that's a very different thing than, okay, now we affirm without questioning. Part of psychotherapy and psychiatric challenges in general is you want to make sure that you're comprehensively understanding things as this child's developing and as someone's talking with you about it. One of the big pieces of this is this rush. So if you meet with someone once or twice, to me, it makes no sense that all of a sudden there's certainty there. And I really hope people can have that as a takeaway, that if you're sitting in front of a physician of any kind and they are 100% certain, with few exception, that this is going to be the solution, the only solution, and everything else will get better, you really should question that. There are very few things in medicine, and especially in mental health, that we can say, well, we're 100% certain on that. So to say these blockers are going to be, we're 100% certain they're going to help you examine things more with zero side effects and they're fully reversible. Well, we know they're not. But additionally, if they're saying that with certainty this is going to help, I would question that. So there's this certainty, there's this rush. I also think there's a lot of pressure in much bigger institutions, big hospital settings where people are part of academic settings and they're worried they're going to lose their job, they're going to lose their tenure. They don't want to be seen as not inclusive or not supportive, and not compassionate. And what's unfortunate is then you end up in this affirming model. Compassion, when it's uncoupled from truth, it's a cruel thing to do, especially to a child.
Yeah. Before I go any farther, just listening to what you're saying on the conditions that would cause otherwise good people, smart people, reasonable people, well-trained people to mutilate little children's bodies after one or two visits. And I've sat with Chloe in many different spaces and heard her story that it wasn't more than two visits, that it was determined, or that her parents were then brought into the room and told either you have a dead daughter or an alive son, you pick, right? It wasn't after years or even months of the psychiatrist sitting down with Chloe. So I have heard, and Katie from New Hampshire. So I have heard these young girls tell their story, and you're absolutely right. There's a rush. So with that being the case, all of the conditions that will cause these otherwise reasonable and smart people and relatively good people, as we would define it, to do this, is there any hope of waking them up, getting more of them to say no, or have the train left the building?
Yeah, no, I feel like absolutely there's hope. And my hope is by talking more about it, by providing education, by letting people understand that this is not backed by a tremendous amount of research that's, huge systematic reviews. This is not based on really anything that in any other form of medicine, we would never do it this way, right? But I think what's so important is, yes, there's hope, but I want us to get in front of it before thousands or tens of thousands or hundreds of thousands of kids are harmed. I think that's where I feel very passionate about getting this out there to anyone and everyone. I think what you said before, to say to a parent that would you rather have a dead child or a trans child, that's emotional manipulation. I think it should be criminal. Because what you're saying is these are your only two choices, and that's absolutely not accurate. And I cannot imagine as a parent, if you're presented with that choice. I've had a lot of folks ask, well, how can these parents put their children through this? Well, they've been absolutely told by experts that should have their child and their family's best interest at heart, that this is what you do. And I think that is where the medical and mental health field has failed these children and these families horribly. And I don't understand that. This is the first time I've ever seen suicidality be part of a diagnostic criteria. So if someone is threatening suicide, that's when you move towards medicalization and surgery. In any other case, you hospitalize and you stabilize. If someone's actively going to harm themselves, everything comes to a hard stop, and you help. And you don't make giant decisions in those moments. You get through that and you get things settled. And then with the way it's being presented to these parents by quote unquote experts is this is the thing that will keep them.
Isn't that interesting though, is that in your profession, what years of study and experience would tell you that if someone is threatening suicide, then the protocol is to stabilize the individual, not to create a very unstable environment And walking alongside Chloe and others, I see a very unstable environment all the way through that process. From the moment, Chloe talks about the moment they put her on blockers. I mean, she was just lethargic. She was exhausted, cloudy, couldn't think clearly. And then they started pumping her with testosterone. And then she just got a rush of energy, became promiscuous in her own words as well. There's a whole backstory with that. And then that honeymoon period falls off. And then now she, just a little bit odd relative to those who are around her, not quite fitting in, got the face looking like a boy, but she still has the breast. That began to bring her great distress. And then she has the double mastectomy, and there's still no stability there because she touched her chest, but feels the sensation in her arm, right? So none of that sounds like stability. It sounds as though you're doing the opposite of what years of training would tell you, that if I came to you and presented myself as being suicidal, your first response would be to stabilize me. But instead, what I'm watching as I'm walking alongside her and listening to her stories and the stories of others, they're in fact doing the opposite. They're creating even greater instability.
Well, and I also think, you have to look at, and this is, I think, a little bit unique in our country, is that there's so much specialization. There's an endocrinologist, and there's a surgeon, and there's a therapist, and even if they're working on a team, what you look at is these children are told, okay, you're going to become more aligned with who you really are authentically. So you can't really have side effects, and they also are hearing this online. So the influencers and the TikToks and all of this are saying, okay, if you are having side effects and you don't feel better on this, maybe you're not really trans. Maybe you're making this up. So then there's a fear of communicating about the side effects themselves. And Chloe's talked about this a lot, the idea that she didn't want to go to her parents because she felt like they were trying to support. And she was like, I wanted them to think I was getting better, but it didn't feel that way. And I didn't know what to do. And these children, think about being a child and told, if you don't take these medicines, you're going to kill yourself. So even kids that are not suicidal when they first start, if they develop any thoughts of suicide, who do they tell? Who's safe to go to and say, I think it's the medicine? And then think about all of those risks. So you're taking a child and really, instead of helping them be comfortable and more flexible with who they are and their developing bodies. And I know puberty isn't something we all would sign up to go through again. But when you're going through it with your peers and you're trying to grapple with, things that are developing, it's not permanent, but you're developing into, more adult, not just physically, but mentally, And so I think when you are talking with a child about that, to then, instead of helping them be flexible through all of it, you're really, I think, creating a very fixed mindset for that child about their identity. My parents will only love me if I stay with this trans identity. Or my doctor is saying I'm only going to be healthy once I do that next thing. Well, I don't feel good yet, but let me take the next.
Then maybe there's something wrong with me, right?
Yeah. And then who do you talk to about it? Because you've been told this whole time, this is the thing that it's going to make it all better. What about the 10,000 other things that may be underlying that dysphoria? Maybe it has very little to do with gender, but they've been told this.
There's so many different directions I could go.
Right. We can talk for days about each of them.
Because it's. I think we need to understand. A motto in my life is that knowledge makes a man unfit to be a slave. Frederick Douglass said that, and it had, as one coming out of slavery, and then recognizing that knowledge, understanding of what's going on around you, it makes you unfit to be a slave, right? You're no use to anybody as a slave anyway, right? Because you won't just shut up and sit down and go along. Now you're asking questions. So you're unfit to be a slave at this point. And so this is one of my great desires is to, there's a lot of us who are being told, well, you're not a doctor. We saw that a lot during COVID. Well, you're not a scientist. You're not a doctor. You don't understand. Just shut up, sit down, be quiet, do as you're told, right? And yet, again, these things are just common sense, right? Why would I jab myself with an experimental vaccine if I'm uncomfortable with it? Why is there such a rush to do this? And you and I haven't even talked on where you stand with the vaccine. But the fact that I should be able to have that, to be able to say that out loud without someone calling me a Walmart shopper, as some people say, I can smell them. I'm not.
What I do tell folks, though, is with your own children, you absolutely are the expert. Hands down, you know your children better than anyone else. And I know there are really extreme exceptions of abuse and neglect, and that's not what we're talking about here. But whether it's a doctor or it's a teacher or it's an endocrinologist or a surgeon, their connection with your child is fairly transient compared to how long you know your child. You've known them since before they were born, and you were counting their fingers and toes when they were a tiny baby. And so there is no person that is a greater expert than a parent. And so I remind parents of that all the time. Do not let someone tell you otherwise. If you are having that intuition is telling you this isn't right, my child, I think they're feeling worse. Listen to that.
Yeah. Hey, everyone. Just want to interrupt the podcast for a moment to tell you about a special offer. Mike Lindell has done it again. As usual, he's out there in the world finding solutions to problems we all have. My towels solved a problem that we all had with towels. You go into the store, they look so pretty, they look so soft, they feel soft, they look lotiony, and then you get them home and they don't actually dry your body. Well, that's why Mike Lindell made my towels. They actually work. They're soft and they absorb. And now My Pillow is excited to announce 2 brand new lines of my towels. Now, what makes them the best towels ever is that they're now made with a 100% long staple Sherpa cotton. This is a comb ring spun cotton that makes my towels even softer and more absorbent than ever. And now you get a 6-piece set for an amazing introductory price of $29.98. Now, that's not happening. I'm sure you're out there trying to purchase new towels now. You have friends and family coming over for the holidays, and you know that you're not going to get a 6-piece towel set of this quality for $29.98, but you can go to mypillow.com, use promo code Kathy with a K, or call 800-988-3934. That's 800-988-3934 and get your 6-piece introductory set for $29.98. You can get a designer premium line for just $20 more. Either way, you save $50. Everyone actually gets dried off and you look like a champ. So they actually work. Just go to mypillow.com and use promo code Kathy with a K. This offer won't last long, so please go order now. Let me go back to a couple of things that you said, because I think it's very interesting. I'm a Christian. I grew up in the very deep South, gave my life to the Lord in the very deep South. There are some aspects of the church I was a part of that could feel a little cultish at times. And something you said triggered a thought that I remember having when I first gave my life to the Lord, that if I just couldn't do right, or if I made a mistake, or if I, according to the Bible, sin, and then I would say to someone, I had this thought, I don't really want this thought in my head. I don't know how this thought popped in my head. And then I remember someone saying to me, oh, then you must not be doing it right. There's something wrong with you. And if you are a Christian and a devout Christian and you're like, well, God, I want to be right. I believe that my salvation is tied to my relationship with you. And then someone says to me, well, you're not doing it right. There must be something wrong with you. Right. And I remember the anxiety and the angst that I felt during that. So when you said, and it reminded me of, I too have heard Chloe say it many times, that when she still didn't feel as she thought she would feel, she still didn't feel like a boy. And then when she would say these things out loud, people began to guilt trip her and say, well, there must be something wrong with you. You now no longer have the ability to have a relationship with us, which is the same thing, a relationship with Christ. But now, the trans community, who was very affirming towards her when she was initially going through, all of a sudden turn their back on her. They're spitting on her. They're screaming at her. They're saying, they're saying she's going to kill other real trans kids. And that is a cult. I recognize that that's very cult-like behavior when the church does it, and it's very cult-like behavior when the trans community do it to someone who has sacrificed her breast in the quest to be physically as she saw herself mentally, and it didn't work out. Now she has questions, and they're like, shut up, be quiet, or else something's wrong with you, not the process, but there's something wrong with you. Can you talk about that?
Oh, absolutely. And I think additionally, there were several talks I heard her give about that they blamed her for it. They said, oh, well, it's kind of on you. You knew what you were doing. My gosh, she was a child. And she was trusting the experts, and her parents were trying to support her, and they were doing everything they could and following the lead of quote unquote experts. And so absolutely, I think that's where certainly the social media piece comes in. Social media. And I think, certainly during the pandemic, kids were on devices so much more. And then they were trying, you go down those rabbit holes of, if you don't feel good, you want to find out why. That's a very natural thing to do. And when developmentally, you're not ready to grapple with adult concepts, sexual relationships, and especially online, it can get very scary. Children can say, I don't want to be that, nor should they want to be that, because they are not developmentally there, even with, when you think about, for example, an 8-year-old or a 12-year-old like Chloe was, seeing, oh, well, if becoming an adult female looks like that, I don't want anything to do with that. But she wasn't developmentally ready, nor does, what is online represent what truly is an adult relationship or loving someone. And, so it's just, there's so many things there where I feel like when you mention cult-like or religious and a religious approach, you accept this no matter what, don't question it. It doesn't matter if there's more, if there's more data that comes out, ignore it. It's transphobic to take a look at, my gosh, there's a lot of these studies coming out that are saying what actually was the case and presented as fact isn't. But you just keep pushing that forward and pushing that forward. And I don't think to say that a child can decipher between, the good data and not good data, when a doctor's saying that it is, I don't know what else she could have done.
Yeah. I remember asking Chloe once, because she said, I thought I was a boy. This is, she's now 19, or at the time 18. And I was asking her, and so she was explaining how she thought she was a boy at 12. And I asked her, well, what did being a boy mean to you?
Mm-hmm.
Right. And she was like, I don't know. I just thought I'd be able to I didn't have to wear a shirt. They seemed like their friendships were different. They could just run around and play. Like, that's not what it means to be a boy. Just like, growing my hair out and wearing fingernail polish isn't what it means to be a girl. Right.
Right. That's more
but she's a child.
Right.
Yes, right. But she's a child. And so I thought that was very interesting. Something you said earlier as well, when I asked you to help me walk across that bridge of how otherwise good people, smart people, would inflict harm to children and go against all their years of study. How would they do that? And you said something that resonated with me. You said, well, where the beginning of this movement is not where it is today. it triggered the thought of activism in medicine, this movement. Should there be a movement in the world of medicine, or in the world of science, or should you be discipline to, because that's what I kind of look to the experts, right? We all abdicate a portion of our responsibilities to other people, right? I'm not going to go and spend the years becoming a doctor. So I'm going to abdicate my lack of interest in this field and listen to you. But I'm abdicating not because you're going to feel or be bullied into a particular movement, but that you're going to lead with science. You're going to ask a question. You're going to observe what it is you see. You're going to create certain scenarios to test it out. And then you're going to come up with an educated hypothesis or guess. And then you're going to keep doing, like, that sounds more scientific than a movement that's based on feelings and experiences. Help talk us through that.
Well, and I think I use the word movement just for lack of a better word for it, because I think what it to me seems to happen, when I work with a patient one-on-one, I have my religious and spiritual beliefs, I have my political beliefs, I have beliefs about a lot of things, but I don't bring it into my therapeutic session with a patient. It doesn't belong there. I'm there to treat them to the best of my ability and knowledge, and provide them with a place where they're not being judged. We're supporting them, but it's also my responsibility to tell them the truth, to let them know that, yes, medications have side effects. Hormones have side effects. And certainly if there are medications or hormones being given off label or in an experimental way, I'm going to also speak to that. That's not my job to bring my beliefs into that room with that person. And that's in every medical and mental health training programs out there. You don't do that. And this is very different. What I've seen is, instead of expertise, we're going to prioritize experience. And in terms of, it's not child-centered or patient-centered, it's child-led. If they say they are, that's what you go with, and you don't question. And that just doesn't make any sense. So when you say how we got here, I don't know if it's this idea of almost civil rights conflated with good medical care and mental health support. What I do see in gender-affirming models is that, well, even if a person isn't distressed, if their gender identity doesn't match up, well, you still give them, hormones if they want them, or if they ask for, if someone came to me, even if they had it, eventually we came to the conclusion, yes, one medicine path, let's say for ADHD, was a good medicine for someone. If they walked into my office and the first day they said, I have ADHD, I saw it on TikTok, I need you to prescribe me a stimulant today. Guess what I'm going to say? I'm not going to write the prescription. I'm going to do what I do with every single patient. Tell me about yourself. What about your medical history? Is there anything that I need to be concerned about? Let's get some blood work done. Do you have cardiac issues? Even if you do have ADHD, it may not be a medicine for you. That doesn't mean you don't have it. Or maybe we start someone on a medicine and they have a negative reaction to it. They do have a side effect. If someone's depressed and they start an antidepressant and they have a negative reaction to it, I don't tell them, well, you're just not depressed. You're not doing it right. It's that you had a side effect to it. So there's so much here that I think there's so much conflation going on
with experience and science. And that leads me to this new trans textbook for psychiatrists. And I was reading through Epic Time. They did a wonderful expose on it. And I just thought it was very interesting. I'm going to just read just a little bit of it, and then I would love your response to it. But it starts off, a new cutting edge textbook on transgenderism written with the help of activists will be used to train psychiatrists, that's you, and could harm millions of children in the future, some experts have warned. That's the reason why I started the way I started with you. Like, who are you? What does it mean to be a psychiatrist? What is all, walk us through some of, the training that you had to go through in order to become a psychiatrist. And then because I'm reading this and it says this new book put out by the American Psychiatric Association. So this is a legitimate arm.
Mm-hmm. This is the supplier of our textbooks.
This is right.
Yeah, almost all of my textbooks from residency, you are required to use those.
Okay, so the American Psychiatric Association publishes all of the books that are used, the overwhelming majority of the books that's used in your training of being a psychiatrist. And so now APA, this organization that publishes the majority of the books that doctors like you use and training to be trained with, has just published a cutting edge textbook on transgenderism written with the help of activists. And I'm like, why are activists getting involved with their experiences to train doctors? Where I'm thinking as a layperson, you should be more in the realm of science, real science, right? But then it goes on. Gender-Affirming Psychiatric Care just released this particular book. The textbook signals early on that it's more subjective than objective. Quoting a feminist studies professor say, scientific neutrality is a fallacy. Break this down for me. What is going on? Like what is happening here?
You were going to tell me. That was my reaction. I have been a member of the American Psychiatric Association since 2009. When I started my resident, I have been a fellow for years. I've been very involved with them. So the day I got the email from them that this new book had come out, I got it and I started reading it, and I was devastated that this group, the American Psychiatric Association, is our association that is supposed to represent a consensus of everything that our medical and psychiatric knowledge supports. And I was shocked to say that, it's a fallacy to talk about. There is one of the chapters that says that puberty blockers are fully reversible. And that's a flat out wrong statement. And to me, the biggest danger, though, of this is that because of the way that they present, that they are peer reviewed above and beyond anyone else, and in research and in publications, that's a huge bar to reach, that anyone that would read it would assume, well, then it's been through all of this rigorous, these studies must be supported. Why they don't have the time to go check, thousands of references that they're looking at. They trust this as a textbook. We're going to use it as a teaching tool. It also says it's not just for psychiatry, but for primary care. It's going to be an integral part of primary care. So in pediatrics and internal medicine and endocrinology, they can all look to this. And it does talk about caring for children, how to talk to parents about affirming, how to medicalize, how to surgically, how to participate in writing letters. And that is your job, is to be an activist and to promote affirmation at all times. I've never seen anything like it.
I mean, it is startling. These people are not playing. They have, because again, when I looked up the APA, I didn't know that it would, I was trying to find another organization that would do the publishing, but I just kept coming across APA. And now you tell me they produce the overwhelming majority of the books that our doctors are trained with. And given that this particular book, Gender-Affirming Psychiatric Care, that's been written with the help of over 50, I believe, authors, more than half of them being activists, and the high hurdle of peer review, and the fact that it's going to be looked at as, well, this must be true. And this is what's going to be used to train the next generation of doctors, right?
And litigate. It's going to be used in front of judges and juries, and it's going to be handed to parents and say, look, it says right here, this is what you do.
Dr. Lauren, this is such a fascinating topic. I am so grateful that you have graciously agreed to giving us another hour of your time. So we're going to wrap up part 1. We're going to go into part 2. You guys will see this the following week, but this is just it's so important in this culture, because let me just say, as we close out of this, and again, come back next week, you'll hear the second part of this, but this conversation is so important. It is not just something that is happening to those people over there. This is also being used to create a different America, I believe, a different culture than the one that has allowed us to live as a civil society. I believe, there are things that can happen. It's that you generally hear people say the enemy from without and the enemy from within. I believe we have enemies all around the world that would love to cause great distress and distortion in how we live as a people. But let's just lay that to the side for a moment, because I think we have enemies from within as well, maybe even well-meaning enemies, but enemies nonetheless to those particular fibers that make us a civil society. And perhaps the reason why this issue of transgenderism just won't leave me, and I feel a need to keep leaning in, to keep talking about it, to keep trying to grow my own level of understanding, because there is nothing that will cause I'm sure you guys have heard of that analogy, mama bear. There is nothing that will cause someone to do whatever is necessary to protect their children, to protect the environment in which they're going in, than this topic of transgenderism and how it's being talked about in schools, how schools are now talking and advocating for children to live however they want to live, not even talking to the parents about it. Some states are having conversations about children starting the transition without the parents' permission, if you can believe that or not. Grown men dressing in prostitute attire and reading story time to your children. Grown men walking behind your daughter into a restroom. These things are not natural. They are not something that we should become comfortable with occurring. And at the very least, I believe those of us who disagree with the minority that is pushing this way of thinking on us, at the very least, we should not be shut out from conversation. We should not be told to shut up, to sit down, to be quiet, to just do as you're told, or you're going to be labeled with some really horrific name. So that's the reason why I want to talk about this. That's the reason why I'm going to continue talking about it, because I think there are bigger implications at play. That if we as a society do not begin to stand up and, like that little boy, and say the emperor has no clothes on, this is foolishness, and I'm not going to play along with it. So, Dr. Schwartz, thank you so much for taking time out, and I'm looking forward to part 2.